Hi, everybody. I'm Barb.
I'm Randine.
I'm Brandy.
And this is our Sclero-What Adventures. Thank you so much, everybody, for tuning in this whole month. We are so honored and privileged to be able to bring to you scleroderma patients every single day so that you get to see and hear from them directly, because honestly, we believe that that is the best way to learn about scleroderma. And so that's how we're celebrating Scleroderma Awareness Month, which is the entire month of June. And we are so excited to have Brandy here with us today. Thank you so much for joining us. Welcome.
Thank you. No problem. My pleasure.
And Brandy is joining us from Ontario, Canada. We are so happy to have our neighbors to the north with us today. So tell us, Brandy, what form of scleroderma do you have?
I have systemic diffuse scleroderma.
All right. And when were you diagnosed?
I was diagnosed shortly after I had my daughter in 2008.
2008. And what was your first symptom?
You know what, when I look back to it, like I used to tell my family physician that I needed to see a rheumatologist when I was about 21. I started to get like little cuts on my fingers and that wouldn't heal properly. And I just knew something, like I felt fine, but just like I wasn't healing properly. Like bruising, like just weird, so I thought something was going on. And I kept trying to say like, and he would say, no, you're fine. It's nothing. And then after I had my daughter, things came to a screaming halt and we knew something was wrong, because I think the trauma to the body. And then that's when they finally gave me a rheumatologist, and he knew exactly what it was right when I was diagnosed, but he said, I don't know how to treat you because I've never treated this disease. So then that scared me, right? But because I was 24, a new mom, and I was like, whoa. And then I found a good rheumatologist in Toronto, and it made a huge difference because you want to get treated like, and I mean, there's no right treatment for any scleroderma patient, but with a good team of physicians, it makes a world of difference. It really does.
But kudos to that doctor that was honest and said, I don't know how to treat
Yeah.
it, instead of like taking it and trying to do whatever. So
yes,
doctor.
Yeah, it was great. Like I appreciate like the honesty. So that was awesome that he was just like, you need someone good. You're young, like you can have a good life. You just need proper care.
Good.
So
Absolutely. So what is one thing that you would tell your pre-diagnosis self?
Don't sweat the small stuff. Don't sweat the small
Good
stuff
one.
because like the worries that I used to worry about, I think like, oh wow, to worry, like to have those worries back, like, so life is too short to sweat the small stuff, really, like, and I have to tell myself that still now, right? Because I think that's forever with you. Just like I have a little bit of anxiety about things, but I just you just got to learn how to cope. Everybody copes with things differently, but just don't sweat it because life's too short.
Yeah,
I love that. And so what does Scleroderma Awareness Month mean to you?
Well, I believe that first of all, you have to be your own advocate and talk about it. And because at first I'd never talked about it, like I never did, because I was almost embarrassed. I hate to say that, but I didn't understand it enough, enough, I guess. And there was just so much information, and everyone seemed to be so different. There was like not one prognosis, and I had a really hard time with that. But now I think that a big thing is to talk to others about it. even my family, like some of them still don't understand things. So I talk to them about it. I'm like, oh, and like I was just diagnosed with Crohn's. And it's like a lot of scleroderma patients have that. And it's, as soon as you get scleroderma, unfortunately, there are a long list of other things that can go wrong. And at first I didn't look, because if you look at what could go wrong, you're like, oh, well, this just isn't good. So I just kind of take it as it comes. And I think that educate others, like, and do the walks around here, talk to, like the best thing I ever did was go to a walk. And that's where I met one of my best friends that has scleroderma. And she's changed my life. So for the better, right? Because it's hard when you don't have someone to relate to. That's, like a lot of people my age, when I was first diagnosed, I was 24, you were young as well. And it's hard because you're like, well, I should be talking to, like, not to be rude or anything, but like my grandmas, because I feel like I'm on the same medications, like I have a lot in common with these, with the ailments of like rheumatoid arthritis and things like that. But yeah, I don't know.
I can totally relate, Brandy. I was 22 when I was diagnosed, and I felt exactly the same way.
Right. So yeah.
Yes, absolutely. Yeah. Well, what is one blessing that scleroderma has brought to you?
I think it made me as a person much more compassionate and empathetic. And my kids, to watch my kids are, oh my God, the epitome of what I would have wanted to be as a kid, to watch them be the beautiful people they are because of what they watch me go through. It has made them really like just beautiful people, right? So that to me has been a blessing, is I know it's not the greatest thing for them to watch their mom go through, but I talk to them about it and I'm pretty honest with them. And it's given them a different outlook on, like a lot of kids don't have that, right? So, I mean, it's not the greatest thing, but it makes them who they are. So.
Absolutely. Oh, I love that. Yeah. What is one thing about scleroderma that you would like everyone to know?
I think it doesn't matter. When I was diagnosed, they said that, oh, wow, like you're young. I'm sure you had that too. And they're like, oh, well, I have never seen anyone under 50. It can strike you at any age. Doesn't matter your color, your religion. It doesn't care if you're rich or poor. It can get you anyway, but and that's the scary thing. So, and none of us are the same, none of us. So it's hard for them to treat us because we're all so different, right?
We are all so different. Oh, so very true. No truer words have been spoken.
No.
Yeah.
Yes. The doctors definitely have their hands full with scleroderma patients.
They do. I know.
They do.
We're wild cards because they just don't know.
That's right.
Yeah.
Well, speaking of the wild card, now we have this wild card. I'll ask you a few questions.
Awesome.
Random Randine questions. You brought up your kids. What's a big sport that they're involved in Canada?
Basketball. We are a basketball family.
Okay.
Go Raptors.
What is your favorite beer?
I love me some Miller Lite. I do.
Miller Lite, yes.
And let me tell you, if I could go to a pub down in the States right now and have a Miller Lite on draft, I won't leave. I wouldn't leave.
A bottomless cup is what you would want.
Yeah. Oh yeah.
So if you had to choose between a Miller Lite and Fruity Pebbles, what would it be?
Can I not mix the two?
That's a good one.
I could have my Fruity Pebbles in my Miller Lite.
With a spoon.
Yeah. Hey, I don't discriminate.
Oh, that's hilarious. I have a question coming up about what would be the oddest food you could combine. Boom, you got it.
Well, there you go.
My next question, last one will be, if you could interview a famous person or just a random family person, who would it be and why?
We are a huge fan of the Tragically Hip here. I don't know if you guys know who they are. They were a huge Canadian band here, and this singer was diagnosed with brain cancer a few years ago, and he passed away. And we just loved him. Everything about him that I would choose him to pick his brain. Like, we love music in our house. We are big. That's what we do. Like, we just love music. So that's our big thing here. And yeah, just because I think he's a brilliant, his name was Gord Downey, and I think because he was brilliant, just brilliant.
Nice. How about you, Barb? Who would you choose?
I think, did we have this conversation the other day, Randy? I feel like I just had this conversation with
Not
somebody.
with me.
Maybe Mike and I had this conversation, and on it, like, I was literally, this is like deja vu to me, because I really did just have this conversation, and I decided that the person I would like to interview would be Oprah Winfrey.
Oh, that's a good one. That's
Yeah.
a good one. Can you imagine? She's
Can you
like seen it
imagine?
all. No.
Oprah,
That's a good-
join us.
Yeah, like, I know. Where are
Yeah,
you, Oprah?
Yeah. Yeah. I don't know if I could get my words out, because I'd be so nervous, like interviewing her, but oh my goodness.
No doubt. No.
The
I would
story
come
she
up
could
with some-
tell.
I would come
Oh,
up with
right?
crazy questions for her.
Oh, I'm sure
Oh,
you would. I'm sure you would. Yes. Well, thank you so much, Brandy, for joining us today. We
No
so
problem.
appreciate you giving us your time and energy. And we just appreciate all of you guys for watching us this whole month. Stay
Yeah.
tuned. We will be coming to you again tomorrow, and we'll be bringing somebody new. You just never know what you're going to hear with Randy and Barb. So, so with that, you guys, we'll see you tomorrow.
Bye.
Bye.